Okay. Social support. We know that, as stated a few slides earlier, that the social functioning in rural elderly is poorer than the urban counterparts. So we know that the emotional well-being will also be a little bit worse than in urban areas. So with that being said, we know that human relationships are important. We should promote to our elders to maintain healthy relationships because it enhances quality of life for our older adults. Um, so that is essentially important, enhancing that quality of life. Um, we know that some of healthcare risks associated with social isolation have been compared in magnitude to the well-known dangers of smoking cigarettes and obesity. Individuals who lack social connection or report frequent feeling of loneliness tend to suffer higher rates of morbidity and mortality, as well as infection, depression, and cognitive decline. This is that's why I stated that it is important to have those types of human relationships and human interactions, positive ones, because it does tend to affect an individual's health. Current policies and programs that affect our elders, Medicare and Medicaid, as stated, these are always constantly up for debate and changes, cutbacks. But like I've stated, we know that the population is growing, so there's going to have to be some type of new policy that's implemented or some type of extension and increase in these medical needs, because we know that our older adults tend to use health the healthcare facilities and things like that more so than any other population group, so any other age group. HUD-VASH programs, that's housing urban development. They tend to help out with housing for low-income elders, like Section 8. So they offer Section 8 vouchers to low-income elders. SNAP, which is the Supplemental Nutrition Assistance Program. It's the food stamp program. So it helps out with the need based on income, of course. Helps out the deficit so that the older adults are able to afford the food that they need. And it's stated there that older rural adults suffer from food insecurity more so than their urban counterparts. And that could be due to the fact that, once again, urban areas have more resources like food banks and food pantries than rural areas. And so that could be one of the reasons why older adults in rural areas suffer from food insecurity, and also due to the lack of, even after receiving food stamps, still not being financially able to purchase what they need. Sometimes they have to choose between purchasing medication for the month or purchasing food. Like I said, SNAP is income based. So sometimes our elders are receiving maybe $15 in food stamps, and just because they're receiving Social Security. So we just have to be mindful that even though they do still receive SNAP, that they could still be struggling to afford the necessities that they need. I stated Social Security, which is a program that you actually pay into. So if an older adult had not paid into Social Security by working, um, then they will not be eligible to receive Social Security. Instead, they will receive maybe something like supplemental security income, where they're offered some monetary assistance. Um, monetary assistance when if they do not qualify for Social Security income. Area Agency on Aging, that is a big program that I know is in the state of Alabama, that offers a variety of different programs within their organization, like Meals on Wheels and things of that nature, aiding the elder in helping them to apply for food stamps, things of that nature. So that's a positive for the older population. What could social workers do? Of course, continue to promote advocacy and policy development that aids in the improvements of rural infrastructure, economic development, availability and access to healthcare needs, reliable transportation, and affordable transportation as well, delivery of service, public services, and literacy. Social workers could also continually educate themselves and co-workers of the support needed to provide a broad range of services within rural areas. Should also assess needs and resources within the rural areas, because we know that each community is different. So the needs may be different depending on which rural area you may be in. Also, think broadly about the factors that influence health. As stated, social isolation could be very detrimental to the health of an older adult. So just continue to be mindful of factors that could influence the overall health of our older adults. And these are my references.